you guys, I'm back. I didn't do too well with the last lecture. It's just like I just started talking and I didn't ramble, but I did have a lot to say about conditions and illnesses because I've seen them be neglected. I've seen fitness professionals not do the proper assessment, and I've seen people have an asthma attack on the fitness floor, and that's pretty scary. I've seen people who might be going through, who are on prescription for hypertension. And to prescribe a lot of exercises that involves a lot of up and down, hypertension, hypotension, any type of vascular disease, and you're asking people to go up and down. I've seen trainers not know why their client has passed out. So I've seen a number of things. So conditions and illnesses are very important to address, just like it's time to address communicable diseases. Communicable diseases, okay, in the age of COVID-19. Okay. So those who may have had me last semester know that I have given a stern announcement about you not feeling good. If you do not feel good, okay, as far as face-to-face is concerned, when we return, if you don't feel good, don't come near me. Okay. Period. Okay. Don't come near me. But that's not saying to be selfish or whatever, because I really want you guys to go home and get some rest. Okay. Wash your hands, take care of yourself. Remind app activity. I'm going to see how many of you guys actually do the Remind app. Well, I already know a lot of y'all not doing the Remind app activities, but I'm curious to know. Take a picture of the thing that is helping you, keeping your immune system good. I take these. This is not a sponsored ad. Okay. And I sometimes put these in my water. Okay. It's good as far as vegetables are concerned, just to kind of help keep the immune system going in the age of Corona and the early start of the flu season. Very important to address, working in a fitness center, working in a physical therapy clinic, working in a gym. These things are important. Okay. Whether you agree with vaccinations or not. Okay. Vaccinations are there to put a form of the microorganism into the body of the person to be able to build immunity. Okay. That's the purpose of a flu vaccine. That's the purpose of, you may have gotten something when you were a kid called MMR, measles, mumps, rubella, tetanus shot. Older people are being requested, or it's recommended for older Americans to take a pneumonia vaccine. Whether you agree with them or not, vaccinations are designed to put that microorganism, whether it's alive or dead, into the person's body to fight immunity. Okay. Now, whether you want to find a stance, whether you agree with it or not, the best thing that I could do is do your research. It's the best thing. That's the only thing I'm going to say, but make sure that you do your research. And of course, talks about a healthy immune system. There you go. That's my go-to for a healthy immune system. If this is a Remind app activity, take a picture of what is keeping your immune system healthy. I am curious to see. You can't send pictures through the Remind app, but a healthy immune system is ideal in being able to fight all this junk that's in the air during flu season, during the season of COVID, during the season of strep throats. I've had strep throat. Oh my gosh. And so it's just very important to maintain a healthy immune system by reducing your stress. I've talked to a few students. Some of you guys are sitting there doing homework for hours and hours and hours and hours and hours and hours, like more than 5 hours. Even though the professors want you to do your work, got to plan properly. So we're not sitting in front of a computer all day. Okay. So it's good to get rest. It's good. The best thing that you could do also, stay hydrated, drink your water. Okay. By keeping everything lubricated, drink your water. Okay. Microorganisms and bacterias and that type of thing, they're going to attach to your body if everything on you is dry. So stay hydrated. And that's part of your public awareness, knowing what you should and should do. Let's hope that you know that you are supposed to wash your hands after you eat, after a restroom visit, after you touch your hair, before you touch your face, after you touch money, after you touch your card, your cell phone. Cell phone is dirty. It carries more microorganisms on it than poop, because some of you guys are taking your phones into the bathroom. Stop that. And if you do take your phone into the bathroom, wipe it down. Okay. But it's all about public awareness. So Like I said, Remind app activity. What should you not do with your phone? Taking it to the bathroom. I'm eager to see your responses in the Remind app. All right. So there's different ways of spreading diseases. We're talking about COVID-19 being airborne. Okay. Airborne is that it's passed through particles, through sneezing, through coughing. You have direct methods through touching blood, touching vomit, touching diarrhea or feces. And then you have indirect, where you're touching an object, a surface, a dirty laptop, someone's doorknob, a phone, that type of thing. And then you have a vector, which is basically an insect, like a mosquito just transporting disease to disease. So those are just really, but I mean, generally speaking, the main one is, for the most part, is the top three: direct, indirect, and airborne. So we always talked about sneezing. Where should you sneeze and cough? Right in the pit of your arm, not the palm of your hand, because you're not going to turn around and go to a sink right after you sneeze, especially if you're in a classroom. Okay. So it's always so important to sneeze in the pit of your arm, cough in the pit of your arm. Unlike me, I don't like wiping my nose in public because it's gross. So I like to blow my nose and cough away from people. So that's just something I've always done. That's me. I'm weird. It is what it is. Okay. Warts. Okay. Warts generally have to be removed by a dermatologist, and they are painful. Those things don't move, and man, oh man, they hurt. You can get plantar warts, and it does hurt to put on shoes, does hurt to walk, and it always happens at the bottom of the foot, and it is a form of HPV. All right. How many of us have had chickenpox? I've never had chickenpox, so I put my hand up to say that I've only been vaccinated for chickenpox, because myself, my mom, and my brothers have never had chickenpox. We're the only people in our family to never have chickenpox, but I have been vaccinated. That's what we talked about earlier, that the microorganism is being injected into your body to fight immunity. I've heard chickenpox is worse as an adult, so God forbid, knock on wood, if I were to get chickenpox as an adult, I've been vaccinated so I can fight it better. All right. So that's what you may have heard about the varicella. Now, you're probably wondering, let's say, for example, you transfer schools, or maybe you're going to another school, or maybe you are just doing something that's athletic that might require a varicella vaccine. Okay. It's all it is chickenpox. Now, if you're like, no, I don't never had it. I don't know if I ever had a varicella vaccine. I don't know. When I was in undergrad playing a sport, I remember very distinctly how big that needle was for a varicella shot. But if you don't know, you can simply ask for a titer. Okay. Basically it is a blood test that examines your immunity to different things. Most common one being varicella or chickenpox. Okay. All it is just chickenpox is just basically contagious lesions all over the body, lesions, not legions, but lesions all over the body. Sometimes you'll hear parents say that when there's one child that has chickenpox, they're going to put their child with that child just to build immunity. Because once they get it, they're virtually immune. They probably won't see it again. If it wakes up when the person is older, it comes back in a form of shingles. Okay. And from what I hear about shingles, I heard shingles was extremely painful. All right. We've had these vaccines before. You've heard of MMR. Okay. So this is what they are. Basically, I don't want to say it has been eradicated, because there have been some cases that have been popping up within the last 10 years. But this is the reason why an MMR vaccination is important. Because I mean, these particular diseases are highly contagious. Okay. They can start out as cold-like symptoms, high temperature, rash, but you won't know until you get tested. And of course, you'll notice mumps having just swollen glands. So just kind of touching around the neck area to see. But I don't want to say it's eradicated, because, like I said, there have been some cases, but it's not as common anymore, but can happen. Okay, meningitis. Some of us have had a meningococcal vaccine, another important vaccine, especially for those who are living on campus. Okay. You may have had the vaccine. These are very serious because all it is inflammation of the lining covering the brain. And the symptoms are just headache, stiff neck, high fever. This is important because I hope you guys are not doing this. Sharing water bottles, sharing cups. It's common for people to just kind of take a Gatorade cup that you already had your lips on and you just dip it in the cooler of Gatorade and just keep on sipping. So no, okay, you want to avoid that at all costs. All right, just go from the spout or just go get a bottle of Gatorade of your own. Don't share it. I don't care if it's the whole, and we used to do this as kids where you I just want a swig of your soda. And then as opposed to you getting your own soda, what'd you do? You just tipped the bottle over and try to share it with friends. Don't do that. Okay. Don't do that. All right. So, talked about talking about mono. I'm thinking about a previous class that I've taught about, communicable diseases. Very similar to meningitis, extreme fatigue, fever, body aches, and probably some enlarged glands, particularly your spleen. That does require definitely an examination to ensure how your spleen is doing, because if you are hit and your spleen is enlarged, it can rupture, and that can be bad. So laryngitis and bronchitis. Basically, with laryngitis, and I've had this many times before, you want to just be quiet. Imagine me being quiet, but being quiet. I've been blessed. I haven't had any case of laryngitis in about 2 years because generally it hits me around the same time every year around allergy season. So, unless there is, let's hope you hear this voice again in the spring, which is when it usually occurs. I will be quiet. I will be silent. So, but generally those are the symptoms of just laryngitis. It changes your voice altogether. It's no fun. Okay. Bronchitis, we talked about what itis was, and this is just inflammation of the bronchial passages. It can be an actual infection, but it also can be related to allergies, which is similar to laryngitis. Okay. You might think it's a cold, but I'm even to the point now where I'll go to the doctor, which is kind of where we're at now with COVID-19. Even if we have a cold, we're kind of just going to the doctor, for just kind of a follow-up. My rule of thumb is that if it doesn't clear up within the next couple of days, which a cold can and should clear up in the next couple of days, then it's time to go to the physician. Okay. Talked about colds, right? Oh man, don't we love common colds? Okay. Sore throat, coughing, sneezing, runny nose, loss of voice, and just tired. My rule of thumb is that anytime I catch a cold, it's usually my body's warning signal telling me that I need to sit down somewhere. Okay. I need to sit down. I need to get some rest. I need some fluids. I need a little bit of this, a little bit of vitamin C, a little bit more water. The best way to avoid colds, stop sharing stuff. Stop sharing cups. Encourage your athletes to not share cups, okay? But this also includes not only cups, but brushes, equipment, toothbrushes. I've heard of athletes sharing toothbrushes. Don't ask me how, okay? But they were sharing toothbrushes. I'd rather my mouth go dirty, okay, before I share or use somebody else's toothbrush. I don't care who it is. All right. Influenza, aka the flu. Recommendation is that you are vaccinated for the flu every year. The symptoms can be different. You have 2 different types of flu. Tamiflu is the primary basis to be used for influenza, aka the flu. All right. So this chart, which I just took from your book, talks about the different skin lesions that you are going to experience as we kind of talk about more into skin lesions. One way to prevent all this from happening, this video was brought to you by, see if it'll play. Let's see if it'll play. If not, I encourage you to, I didn't even do my timer, so well. I encourage you to wash your hands. I pray all of us know how to wash our hands at this point. So let me see. And I guess it might be close to me stopping because now my PowerPoint don't want to work. All right. That's just dandy. All right, there we go. Where the inflammation with your hair follicle, it feels like a hair bump. It's excruciating. It's incredibly painful. But you can prevent it by taking care of your equipment, keeping it clean, not sharing anything. Good hygiene might mean like in those areas that are tight or where chafing might occur, you're keeping those areas dry and clean and not a lot of moisture going to those areas. So that's how you prevent folliculitis. All right. So boils, and those are not pleasant either. Okay. Good hygiene also plays a role in the prevention of boils. Physicians can pop it. They use antibiotics. Sometimes they'll lance the boil. It's painful. Either way, don't squeeze it. Okay. Do not squeeze it. Basically, it's just a bacterial infection that is within the glands of the skin. They are painful. Don't pop it. Just go to the doctor. All right, so you have two Tinea infections. You have basically athlete's foot and ringworm. Okay, the best advice that I could give in the prevention of this is to make sure that you are not sharing equipment. Make sure that you are mindful of the surfaces that you are touching as far as a public location. So that means do not walk in your dormitory res hall barefooted. Okay, that's just basically what that means. Make sure that you are not barefooted on your athletic training facility floor. Making sure you're not sharing things like boxing gloves and you're not sharing things like equipment. So these are things that are important for your athlete to avoid. On a more holistic level with the treatment of athlete's foot, I was told that tea tree oil treats it, but at the end of the day, please see your physician in the treatment of athlete's foot. Okay. MRSA. It is basically resistant to antibiotics. It is extremely contagious and can be extremely dangerous, can be fatal. So it's very important that you set up your athletic training facility, your fitness center, or any type of environment that might hold moisture because of sweat and because of heat. Keeping those areas clean, making sure that every surface has been wiped as far as the prevention of MRSA. Same thing with Impetigo or Impetigo, potato. It is just a staph or a strep infection that comes with a cluster of blisters. Now we're talking about a cluster of blisters. Here's the scary stuff. Herpes, okay, comes in two types, type 1 and type 2. It is basically just open blisters where it says weeping open blisters. That means that they are constantly oozing. I talked to a student who was in the middle of an outbreak. This was some time ago. And I was doing some additional studies on a student in herpes, and she was very open and candid in telling me, and she said she didn't mind sharing it. I just won't share the name. She said that basically having an active, when it's active, you can't sit, you can't walk, can't do nothing. So if that doesn't scare the crap out of you, I don't know what does. But it's so important to prevent through rest, good nutrition, stress management, and exercise. And you want to prevent that from, in terms of good hygiene. Ultimately, don't share anything. I have ran into students that share forks. So yeah, want to avoid sharing stuff. Then we have blood-borne diseases, which in thinking of blood-borne, we think of more so hepatitis, okay? Hepatitis being inflammation of the liver through a virus, okay? Now, there is one in particular that does take on the form of an I put STI in here. That's incorrect. It's STD because it's not curable. So basically, that's something you have for life, and you will seek medical treatment. But it can be prevented through certain vaccination series. I remember growing up when I was a sixth grader in 1996 that we all had to line up and get these hepatitis shots. So I was probably the last generation that had vaccinations done that way, where you had to line up in the gym. Yeah, I was probably the last generation, because now everybody's just going to a doctor, or some people are just avoiding vaccinations at all. They're avoiding it at all. That's a totally different argument. But back in the day, they used to line us up and tell us we all had to get shots for hepatitis. So did that. And of course, being safe, because hepatitis B does register as an STD. And of course, the one thing that you want to avoid is human immunodeficiency virus, known as HIV, which leads to AIDS. Okay. And the prevention of blood-borne illnesses, if you are a provider, you want to make sure that you have the proper protective equipment, or PPE, to address and clean up vomit, diarrhea, blood. Even when you are assessing an athlete or a patient that might have an injury, right on down to a cut. Okay. I'm talking like just a paper cut. If you have a classmate that might have a paper cut, don't try to nurse them. Okay. You want to give them a Band-Aid, and you want to give them an antiseptic wipe and encourage them to go clean it off. Okay. And that is not just because no, I don't even want. That's because that's just being safe. That's prevention of not only for you to acquire a blood-borne illness, but also protection for them. So anytime you're in an environment where there might be blood, where there might be feces, there might be urine, you always want to wear protective equipment, gloves, masks, that type of thing. Always where it says use universal precaution for treating and disposing contaminated materials. If you want to recognize this is an environmental question as far as where things are set up, generally near a first aid kit is a kind of a blood-borne kit where it allows you to clean up feces, vomit, blood, urine, that type of thing. Oftentimes you may have seen cleaning staff kind of sprinkle kind of like a sand-like product. What that does is that it absorbs the urine, the blood, the feces, the vomit, so it could be swept, and so it won't be anything left over. And so in that sandy product, it basically absorbs that substance, and it's swept away. Of course, behind it, you should mop and you should sanitize the area. But ideally, you want to acknowledge and know where these pieces of equipment are, as far as cleaning up something like that. Maybe you don't know. Maybe it's a good idea to familiarize yourself with the janitorial staff that can help you clean up those things. Okay. So this point, make sure you take your quiz 4. All right. So as I said, there's remind activities written through these videos. So please watch them and please participate. I'm eager to hear from you guys. Peace.